Hi everyone, welcome back to your channel I Love Pharmacology. In this session, let us learn about the drugs which are useful in the treatment of glaucoma. Welcome to Pharmacotherapy on glaucoma. Myself, Dr. Padmanabha, TS. So, what do you understand by glaucoma? So, glaucoma is a progressive damage to the optic nerve that is associated with raised intraocular pressure whenever there is an intraocular pressure is more than 21 mm of mercury. So this is the definition you need to remember. There is a progressive damage to the optic nerve will take place whenever there is a rise in intraocular pressure more than the 21 mm of mercury. So what are the causes for this? So there are two causes you need to remember. The glaucoma is a condition where there is a rise in the intraocular pressure which can occur due to either due to the excessive production of the aqueous humor or due to the less drainage of the aqueous humor. So your target sites for finding out the drugs will be the drugs need to reduce the excessive production or secretion of the aqueous humor. Simultaneously, you need to check out for the drugs which can increase the drainage of the aqueous humor. So let's see which are those drugs. So as we discuss, there are two groups of drugs, that is the drugs which can decrease the production. We have a mnemonic to remember A, B, C. So A stands for alpha 2 agonist, B stands for beta blocker, and C stands for carbonic anhydrase inhibitors. So these three drugs will predominantly going to decrease the aqueous humor production. Whereas the other group of drug is the drug which can increase the outflow of the aqueous humor. So here you have a mnemonic called as PAP. So P stands for pilocarpine, or you can remember it as a MAP. M stands for miotic or P pilocarpine. A stands for adrenergic agonist, and one more P stands for the prostaglandin analogs. So these are the very important drugs you need to remember. So this slide is very important from your exam point of view. So next comes the individual drugs. So let us see the individual drugs. We have a beta blocker. So beta blocker is a first line drug for the treatment of primary open angle glaucoma. So if you see the ciliary process will have two receptors. So one is the beta 2 receptors. So stimulation of beta 2 receptors will lead to vasodilation. So vasodilation will going to draw more blood flow into the ciliary process. So in turn that will going to increase the aqueous humor secretion or production. So here the target site will be the beta 2 receptor. You need to give a beta blocker to reduce the secretion, of the aqueous humor. So whereas alpha 2 receptors present on the ciliary process will cause vasoconstriction. So thereby there will be less flow of blood to the ciliary process. So this in turn will going to decrease the aqueous humor secretion. So here the target drug will be your alpha agonist, which will going to cause vasoconstriction, thereby it reduces the secretion of the aqueous humor. So in the ciliary process, beta blocker will going to mainly block the beta 2 activity, as well as they increase the or augment the alpha 2 receptor mediated action, thereby it will going to decrease the production of the aqueous humor. So what are all the drugs which are available for the treatment of glaucoma? So under beta blocker, you have a topical timolol, we have a bitoxolol, we have levobitoxolol, we have levobinolol, cartiolol, and metipranolol. So two very important points to remember here is bitoxolol is very safe in bronchial asthma patient because it is a cardioselective agent. It has got less effect on the bronchial smooth muscle contraction. So levobinolol, one more drug, which is a longest acting drug. So beta blocker, what are the side effects? So first, beta blocker can cause bronchoconstriction, it can precipitate or exaggerate the bronchial asthma, it can cause blepharoconjunctivitis, etc., as well as stinging of the eye. So next we have a prostaglandin analogs. So under this we have a prostaglandin F2 alpha analogs. So this will going to increase the uveoscleral outflow. So the prostaglandin analogs are the drug of choice for the treatment of primary open angle glaucoma. So what are all the drugs which comes under the prostaglandin analogs? We have a latanoprost, bemetoprost, unoproston. So what are the adverse effects? So prostaglandin analogs can cause eyelash growth, excessive growth of the eyelash. This can be made utilized in the treatment of hypotrichosis. and it can cause cystoid macular edema, especially in aphakic patients. So next, coming to alpha 2 agonist. So under alpha 2 agonist, you have again the two groups. One is the selective alpha 2 agonist, which will going to decrease the aqueous humor secretion. You have a apraclonidine and brimonidine. Apraclonidine and brimonidine or the selective alpha 2 agonist. But the drawback is the apraclonidine will going to cause lid retraction as a side effect, whereas brimonidine will cause brain depression. That is the CNS depression. It cannot be used in case of children below 2 years because of the chances or risk of sleep apnea. So adrenaline is one more drug which can be used, which is a alpha 2 agonist. The major drawback here is it can cause black pigmentation on the conjunctiva. It is mainly due to the oxidation product which is produced, that is adenochrome. So next we have a dapivirine, which is a prodrug of adrenaline. So here the main action of the adrenaline and dapivirine is it will going to increase the trabecular outflow. This is the main action. Apart from that, it also reduces the aqueous humor production as well as it increases the UVS scleral outflow. So next we have a carbonic anhydrase inhibitor. So you have both oral as well as topical drugs. Under oral you have got astazolamide. Next we have a two topical drugs, that is brinzolamide and dorzolamide. So mechanism here is it will decrease the aqueous humor production. And this astazolamide is mainly used to reduce the pain in case of acute condition, that is in case of the angle closure glaucoma. Just before taking into the surgery, you can go for the astazolamide IV preparations. It will going to reduce the intraocular pressure drastically. So what are all the miotics we know? Under miotics we have pilocarpine as well as physostigmine. Pilocarpine is a directly acting cholinergic agent, whereas physostigmine is a indirectly acting cholinergic agent. So here the mechanism of action of miotic is they are going to increase the aqueous humor outflow through the trabecular meshwork. And pilocarpine, very important thing to remember is due to the short acting capability, it should be used very frequently. Because of the short acting property, it has to be given frequently. Frequent dosing has to be made. And you have two drugs which are not used nowadays and rarely used, that is demacarium and ichthyophed, which are longer acting drug, and the side effect is very important side effect because of which they are used very rarely, that is the cataract formation. So next we have a very important new drug, that is nitarsudil. Nitarsudil is a Rho kinase inhibitor. It is a Rho kinase inhibitor. It is used in the treatment of open angle glaucoma along with the topical latanoprost. So please remember, nitarsudil is a Rho kinase inhibitor which can be used in the treatment of glaucoma. Next you have a closed angle glaucoma. So under closed angle glaucoma, how do you going to treat? So closed angle glaucoma, the initial treatment of choice is IV astazolamide, and other drugs which can be used to reduce the intraocular pressure drastically just before taking into the surgery is the mannitol as well as the miotics. So the definitive treatment for closed angle glaucoma remains the laser peripheral iridotomy or iridectomy. So just to recapitulate, to summarize 6 points in 2 minutes. So please remember, there are two groups of drugs. The drugs which can decrease the aqueous humor production, that is the ABC, alpha 2 agonist. B stands for beta blockers and C stands for carbonic anhydrase inhibitor. So alpha 2 agonist, we have apraclonidine and brimonidine. Apraclonidine side effect is lid retraction, whereas brimonidine is brain depression. It cannot be used in children below 2 years because of the risk of apnea. Then we have a beta blocker. So beta blocker is a first line drug for the treatment of open angle glaucoma. Very two important thing you should remember is betoquerol is safe in bronchial asthma. It does not cause bronchoconstriction because of the cardioselective nature. And the levobinolol is the longest acting beta blocker. So please remember, beta blocker is contraindicated if the patient has got the bronchial asthma, because beta blocker will going to precipitate bronchial asthma. So carbonic anhydrase inhibitor, it increases the retinal blood flow, thereby it can cause retinal conjunctivitis or it can cause red eye features. One more group of drugs is to increase the outflow of the aqueous humor. So one is the miotic, that is the pilocarpine and physostigmine. Pilocarpine being a miotic, it can be used to reduce the intraocular pressure. But the drawback is it can cause cataract as well as punctal stenosis. The main mechanism here is to increase the outflow through the trabecular meshwork. The next we have a adrenergic agents. Adrenergic agents like adrenaline epinephrine. The main drawback is again it can cause conjunctival hyperemia, that is red eye. So the action of these drugs will be the outflow of aqueous humor will increase through the trabecular meshwork as well as UV scleral outflow. On the other hand, we have a prostaglandin analogs, like it is a drug of choice. Drug of choice is the latanoprost, prostaglandin F2 analog. The major drawback here is it causes iris pigmentation, eyelash growth will be more, and it can cause macular edema. And the mechanism of action will be it increases the UV scleral outflow. So this was all about the pharmacotherapy of glaucoma. So if you find this video useful, please do subscribe to my channel, I Love Pharmacology, and also do not forget to share and hit the like button for more updates on pharmacological topics. Thank you.